Rabies vaccine, detailed explanation. Introduction. Rabies is a fatal viral disease caused by the rabies virus, which affects the central nervous system. It is transmitted mainly through the bite, scratch, or saliva of infected animals such as dogs, cats, bats, and wild animals. Once symptoms appear, rabies is almost 100% fatal, but it is completely preventable with timely vaccination. Type of rabies vaccine. Modern rabies vaccines are inactivated, killed vaccines, prepared using cell culture techniques. Common types include human diploid cell vaccine, HDCV, purified chick embryo cell vaccine, SECV, purified varicocell rabies vaccine, PVRV. These vaccines are safe, highly effective, and recommended worldwide. Mechanism of action. The rabies vaccine works by stimulating the immune system to produce neutralizing antibodies against the rabies virus. These antibodies prevent the virus from entering nerve cells and reaching the brain, thus stopping the infection before symptoms develop. Indications, uses. Rabies vaccine is used for post-exposure prophylaxis, PEP after an animal bite or scratch. Pre-exposure prophylaxis, PrEP for high-risk individuals such as veterinarians, animal handlers, laboratory workers, and travelers to rabies endemic areas. Post-exposure prophylaxis, PEP, schedule. After a suspected rabid animal bite. Immediate wound washing with soap and running water for at least 15 minutes. Rabies vaccine schedule, IM. Day 0, day of exposure. Day 3. Day 7. Day 14. Rabies immunoglobulin, RIG. Given on day 0 for severe, category 3, exposures. Infiltrated around the wound to provide immediate protection. Pre-exposure prophylaxis, PrEP, schedule. For high-risk individuals. Day 0. Day 7. Day 21 or day 28. Booster doses may be required based on antibody levels. Route of administration. Intramuscular, IM deltoid muscle, preferred. Intravenous injection is not recommended. In children, the anterolateral thigh can be used. Dosage. Standard dose, 1 ml per injection. Same dose for adults and children. Side effects. Most side effects are mild and temporary. Pain, redness, or swelling at injection site. Fever. Headache. Fatigue. Muscle pain. Severe allergic reactions are very rare. Contraindications. No absolute contraindication in post-exposure cases, life-saving vaccine. For pre-exposure vaccination. Severe allergy to previous dose. Use with caution during pregnancy, benefits outweigh risks. Storage. Store at 2 to 8 degrees Celsius. Do not freeze. Protect from light. Importance of rabies vaccine. Rabies is 100% preventable but nearly 100% fatal once symptoms start. Timely vaccination saves lives and is a critical public health intervention, especially in countries where rabies is endemic.